Hi everyone, this is Dr. Fred Macy, cardiologist. I've been asked to speak about treating adult asthma. This is a complex topic, more than one would think. Why? Because the reason for your breathlessness, bronchospasm, or the fact that some providers may have told you you have asthma and you need specific treatment, first needs to be investigated to see if this is a fact. Many people in middle age who have never had a history of asthma in childhood all of a sudden develop such respiratory symptoms in the absence of tobacco abuse. Clearly, tobacco long-term can predispose you to having what we call chronic obstructive pulmonary disease. And this comes in two major categories, more the emphysema or the bronchitis type or the mixed. But these are the cases that are related to tobacco. I'm speaking today about those who have breathlessness who do not have a history of tobacco abuse, which is the majority. What is a differential diagnosis? Well, asthma, of course, can come in middle age, but usually it's in patients who have seasonal allergies. So all of a sudden you moved from one area of the country to another, or you became exposed to new allergens. These are substances in the air, such as pollens, grasses, trees, other pollutants, environmental toxins that perhaps a new industry in your area is suddenly contaminating the local atmosphere with. And this is unfortunately dangerous to our environment. And of course, we need to protect our environment because it harms not only the animal life, the fauna and the flora, but also humans. So you may be developing what we call reactive airway disease because you have seasonal allergies. So you need allergy testing first to identify what you're allergic to. And other than simple medications such as antihistaminic agents or inhaled steroids, you may be best treated with seasonal allergy desensitization therapy. That's where a specific vial, meaning a vaccine, is made depending on the results of your allergy testing. And then you can be given a tiny amount of those items to which you showed an allergic response on your test. And these injections usually go on for at least about a year, and they can be injected, or now we have the ability to give them sublingually. And so that way your immune system gradually becomes accustomed to them and it will not overreact, and you will not have that dreaded bronchospasm. Another differential diagnosis is cardiac asthma. So that is a development of congestive heart failure. Systolic, that is where the heart becomes weak, or diastolic, where the heart becomes stiff. Both of these conditions can cause pulmonary congestion that mimic asthma, but yet it is not asthma as one would expect in children, which is unfortunately an overreaction of the immune system whereby inflammation in the airway occurs and bronchospasm ensues. The true asthmatic is treated with bronchodilators and with anti-inflammatories, often inhaled steroids and a rescue inhaler, and at times a nebulizer at home that has to be given often. And again, if these children are exposed to allergens, their symptoms can become even worse. Some have exercise-induced symptoms in childhood. So when they go outdoors, they try to play sports such as soccer or tennis, and all of a sudden they go into bronchospasm. There are specific treatments for them. A few adults still have this issue of exercise-induced asthma, and there are specific inhalers that may be given and preventive strategies so that they can participate in their preferred sport outdoors without having the exercise-induced asthma symptoms. Again, as a cardiologist, I'm on the lookout for the cardiac asthma type of patient that has been misdiagnosed because they went into the emergency room and cardiac asthma mimics the real bronchoallergic asthma. So the cardiac asthma is treated by treating the heart failure and the underlying risk factors that resulted in the systolic or the diastolic dysfunction with their heart. That is critical. I often see women in their 70s or 80s coming in telling me that they went to the emergency room because they had shortness of breath for a few days and they were told by the ER provider that they had asthma. And I say, it's highly unlikely. More likely than not is you have new onset congestive heart failure or decompensated congestive heart failure. So from a cardiovascular perspective, don't take it for granted that someone label you as asthma, especially after the age of 50, and that's what you have. You should seek another answer. And so a proper evaluation with blood work, tests to check for heart failure. We have a blood test that checks for it. It's called NT-proBNP. It's a blood test. An echocardiogram, and sometimes a stress test, sometimes a cardiac MRI or a cardiac CT may all help to define the exact nature of your shortness of breath. So for today, as a cardiologist, that's all I'll say about that.